आप सबका अभिनंदन और नमस्कार। मैं कुछ बातें हिंदी में और कुछ इंग्लिश में बोलूँगा। और respected Sarma sir, Mayur ji, Dr. Srivastav, Dr. Hitesh, Dr. Chaudhary, I can see now, actually when I didn't notice you. Dear audience, nurses, all the paramedical workers, the people working in the Nemcare hospital, people working for the Care Foundation, students, parents, well, all here gathered here to know about the burn, spreading awareness in the society. That's the job Dr. Sharma has been doing besides giving a clinical care and more emphasis on giving importance to the prevention and the safety of burn and if something happens then how to really deal with that problem. Dr. Srivastav, I joined when Dr. Srivastav was delivering his lecture, the kind of passion he has shown, the kind of articles he had been referring to, the kind of news clippings he has shown. I think that's really very eye-opener. And the way Dr. Mayur was talking with the emotion, I request you, all of you to, I'm a very lighter, I'm not a good speaker, and I believe a little bit of lighter talk. So if you all can watch a video called What Do You Practice? The small boy, 7-year-old boy, 5-7 minutes video. What do you practice? You practice happiness, you'll be very good at it. You'll find happiness in small things. If you practice anger, you will get angry even there is no situation, because you have practiced it, you're so good at it. If you practice anxiety, you will be worrying about the buffalo which you have not purchased yet. That's the kind of things come. The message which I want to give you is that we need to adopt the practice of safety. Wherever I go, I just look like, okay, where is the escape route? How many wires are hanging? How many things are loose? Where things can go wrong? Especially whenever I go to the crowded place, I always assess about the stampede. There have been instances where there had been a stampede with the fire, many places. Similarly, this kind of auditorium the program is going on, and the outside chowkidar boards the door, and he goes for a smoke, and the door is closed, and the fire people get burned. That's what exactly happened in the Upahar cinema. The cinema started, he closed the door. He said, till intermission, till 9:30, nobody is going to come and go out and like that. And that's how people got killed. Everyone got killed, So what I'm trying to tell you is that we need to develop a mindset in the society about the safety. Safety at home, safety at workplace. We should also involve the people from fire safety department. We should take a lot of lessons from them. Every year get your building inspected by them. Even your house for that sake. Electrical safety. Your geyser is not safe. Your mixie may not be safe. Your gas chulha may not be safe. So many accidents have happened. And who are the victims? The children, the women, the elderly people. If you are not careful about your thermostat in the geyser, you will get burned. And burn has got, not only causes immediate pain, but it has got such a, the kind of a disability it creates. Every day 35, 40 people die in India because of burns. Dr. Srivastava has shown you the patricity. Many times we are sitting in volcanoes. What happened in Lebanon? They had caught a ship laden with those explosive material. They stored in one of the godowns. And one day, the electrical spark, that whole godown blew up. I think the half of the city got blasted last year. So what we are collecting also, many times, please do not keep anything inflammable at home. Anything dangerous at home. You'll get burned. Poor women, what kind of cloth they are wearing while cooking the food. They don't care, the loose saris and that get fired. Thank God, the suicide by burning is reducing. Otherwise, women with a lot of anxiety, tensions, premarital tensions, marital tensions, not a cordial relationship, under stress, they had only one way of expressing by burning themselves. I can't deal with this, I can't cope with the situation. This is the most painful way of dying, can you believe it? It's so painful, dying by burning. Anyway, I can go on. I remember each and every accidents which happens related to the burn in the Baroda, those coaching places getting fire. On 26th of January, 2 schools in Haryana getting fire. There's so many incidents which I remember being a trauma surgeon. This is my third posting to the Assam. I was here in 86-88 as a medical officer. Then I was surgeon. When I became surgeon, I was in Kohima as a general surgeon. But during the general surgery, I was given a lot of responsibility related to the burn. Whenever the burn specialist went on leave, I was a surgical trainee. They handed over me to the burn ward, and that's how I learned the managing the burns, right from the resuscitating, learning the right formula, learning the right kind of a point where you should go for excision, where to do the compartment release. And in Nagaland, in fact, the parent of an electrical burn guy taught me the management of electrical burn. I was about to amputate the extremities, and then I read through the books. They came, doctor, please save my boy, save his limb, please do not cut his foot or hand. He had almost 35% deep, the kind of smell you get from the electrical burn. My anesthetist left the patients in the OT and ran away. He gave anesthesia and ran away because it's a rotten, the dry muscles, the human, that awful smell that he couldn't stand. But I was doing repeated debridement, and that's the treatment. You shouldn't be amputating the bigger joints. You should be amputating piece by piece, from periphery you should start. Probably you will require, if the whole burn, maybe, just looking the whole hand is maybe burned. And if you are going for amputation, go for those phalangeal or metatarsal like that, the piece by piece. I learned the management of hydration, maintaining, avoiding myoglobinuria, avoiding renal failure, so many things I can talk on and on about the bus management. One of the bad accidents which happens with our soldiers, I witnessed once in Kargil, they use Bukhari in the winter, and two Muslim tailor boys, they were working there, and in the night, minus 40-degree temperature in all that Kargil side during the winter, all around snow, and their hut got fire. And that's the day when I was resuscitating them. They had 100% full thickness burn. In the burn, the best thing is that your mind is active and alive. You'll be surprised. That never goes cloudy. They were writhing with the pain, two brothers, and I felt this is the right case of euthanasia. And they both were asking, Bhai tu kaisa hai, Bhai tu kaisa hai. Can you believe it? As a clinician, I felt so helpless. And I knew they are going to die in 24, 48 hours or 72 hours. When I was in a place called Sagar, and I had a serving JCO who had more than 40% burn, my job was to resuscitate. It was not a burn center. You require a specialist, a group of people to manage. You require a multi-specialty people, you require an intensivist, you require an infection control guy, you require a dietitian, you require a physiotherapist, orthotist, so many people. Then only the life is saved. And it's not a one-day process. It takes probably months and years. The kind of disability people develop, the kind of keloid and the scars and the contractures people develop, it takes time. So I resuscitated that JCO for 72 hours, maintained him, and I said, I cannot transfer this guy by train. There's no way I can transfer. So I asked for a chopper, lifted them to Lucknow, and got them admitted to the burn center. So we had the resources. Army has got the resources. We need to develop resources over here. Kudos to Dr. Sharma, who has been dedicated to this kind of service of burn care, treating those burn victims, imparting training, imparting prevention strategy, teaching about burns, making public awareness programs. I think more than 40 programs he has done. He has trained so many people in the burn care. And you certainly need dedicated people with the kind of a right mindset who are really dedicated and devoted. They don't go by watch. If they are giving patients a bath, it might take 4 hours. So you need a special kind of people. I'm really very impressed with the profile of Dr. Sharma and the kind of care Nemcare Hospital is providing to the general public in the Northeast. Really kudos to them. To the doctors, like taking right from the beginning, taking care of the hydration, the infection control, the wound debridement, taking care of hypothermia, and besides that, you need to know the art of pain control, giving tetanus prophylaxis, thinking ahead that what can go wrong with this patient, doing underhydration in the elderly, especially among the elderly and children. They are very fragile. Their hydration requires a special intensive care. So a lot of recent advances are happening where special care is given to the burn patients, and anybody with even 40% of burn can be saved. Anybody with a superficial 90% burn can be saved. But things are changing fast. We need to adopt newer technologies, newer anti-inflammatory drugs have been introduced right from the beginning based on the response of the cases. Their nutritional demands, the metabolism goes 40 times high. So you need to involve the nutritionist, dietitian. There are so many, I can go on and on because I've been practicing a burn care. I've been rather indeed from the army. Certainly I had the opportunity to treat all kind of cases and be associated with the plastic surgeons very closely. So I can talk about this. But yes, there is a technology. But the message for today is the safety. You know, home safety, workplace safety, industrial safety. And all these accidents happen because of the human mistakes. And all those people who are losing life, 35,000 odd people losing life in India can be saved, provided we have the safety in our mind. You know, get your, whatever the new structure coming inspected by those people, whatever electrical equipment you are using, whatever electrical appliances and the fittings you have your home, please go as per the specification, always take those instruments. So there are a lot of things have been taught about the first aid, how to, if something happens, how to prevent yourself, how to protect others, all those things. I'm not going to detail into that. So my message is safety, be safety oriented, make your home, your workplace very safe. I'm really grateful that Dr. Sharma invited me for this particular program. I'm really privileged and honored to be here talking to you and with this audience complete full of such a quiet, receptive audience. I'm really, really grateful, and I hope that the Nemcare Hospital and the Burn Care Foundation keep doing their good work. They keep spreading the education and in the building capacity of burn care in the Northeast. As AIIMS we also have our plastic surgeons here, plastic center over here, and soon we'll be setting up a good burn care center and we'll be adding more feathers to this Northeast burn care. I wish we'll be training more people into the burn care in the future. But a great hand of applause for Dr. Sharma, who has been doing really great work for a very, very long time. And I'm very impressed with his contribution. He's written a book. I think I will go through it. And thank you all.